Brachial artery. It is the chief artery of the arm, or is the main artery of the arm. Origin. It begins at the level of lower border of teres major muscle as the continuation of the axillary artery. Termination. It terminates at the level of neck of radius by dividing into radial and ulnar arteries. Relations. Anteriorly, the brachial artery is related to, in the upper part of the arm, it is related to medial cutaneous nerve of forearm. In the middle of the arm, it is related to median nerve which crosses the artery from lateral to medial, and in the lower part of the arm, that is in the cubital fossa, it is related to bicipital aponeurosis. So anteriorly, the brachial artery is related to the medial cutaneous nerve of forearm in the upper part of the arm, the median nerve which crosses from lateral to medial in the middle of the arm, and the bicipital aponeurosis in the cubital fossa, that is in the lower part of the arm. Posteriorly, the artery is related to the following muscles from above downwards. Number 1, long head of triceps. Number 2, medial head of triceps. Number 3, brachialis. Medially, the brachial artery is related to ulnar nerve and basilic vein in the upper part of the arm and to the median nerve in the lower part of the arm. So medially, it is related to ulnar nerve and basilic vein in the upper part and to the median nerve in the lower part. Laterally, in the upper part of the arm, the brachial artery is related to median nerve and biceps, and in the lower part, it is related to the tendon of biceps. So laterally, the brachial artery is related to the median nerve and the biceps in the upper part, and to the tendon of biceps in the lower part. So these are the relations of brachial artery. Branches. Number 1, muscular branches to the muscles of the anterior compartment of arm, namely biceps, brachialis and coracobrachialis. Number 2, profunda brachiae artery, the deep branch and the main branch of the brachial artery. Number 3, superior ulnar collateral artery. Number 4, inferior ulnar collateral artery. Number 5, the terminal branches, that is radial artery and ulnar artery. And finally, the 6th one, nutrient artery, which supplies the humerus bone. Clinical anatomy. Brachial pulse. The brachial artery pulse is commonly felt in the cubital fossa, medial to the tendon of biceps. So if you try to flex your forearm under resistance, you can feel the tendon of biceps. Medial to the tendon of biceps, you can feel the pulsation of the brachial artery clearly in the cubital fossa. Oakman's ischemic contracture. The rupture of the brachial artery in the supracondylar fracture may lead to Oakman's ischemic contracture or Oakman's musculo-ischemic contracture. The laceration of the brachial artery can cause paralysis of the flexor muscles of forearm due to ischemia. As a result, muscle shortens permanently. producing a flexor deformity, which is characterized by flexion of wrist joint, extension of metacarpophalangeal joints and flexion of interphalangeal joint. So flexion of wrist joint, extension of metacarpophalangeal joints and flexion of interphalangeal joint. This is musculoischemic contracture. Workman's musculoischemic contracture. Thank you.